health care done, whatever it takes. She even cleared her schedule of all other appointments, along with all top Democratic leaders, for a health care Papalooza marathon on Capitol Hill today. She's doing the same thing again tomorrow. Mississippi Republican Senator Roger Wicker is not invited there today or tomorrow, but he was kind enough to join us here today. Senator, very good to have you.
Well, glad to be with you, and I don't know if this segment will be quite as animated as that last one you had. It's good to be with you, Neil.
Well, but we mentioned the Kansas City dire situation, Senator. We mentioned, you know, this news on GMAC and the Elizabeth Warren report. She's going to join us later. And something Michael Ozania touched on, this idea that this is a repetitive theme here. Are you worried? Because it doesn't seem to be slowing the momentum for getting health care done, which is always a worthy goal, but carries a very big price tag.
Okay, I'll tell you what's going to slow the momentum is continued public opinion. There are a lot of Democrats, including Nancy Pelosi and Harry Reid, who are willing to defy public opinion. And I think the next 2 weeks are going to tell the tale, whether we move toward Western European style socialism in this country with our health care system. And I believe the American people are going to be heard on this.
Yeah, but
I just have to feel
those
38
Senator,
Democrats are going to stay against it, and
yeah, but
we're
Senator,
going to pick up some
I
more
look at
no
the same
votes.
polls you look at, and I know, depending which one you want to buy or believe, whether it's the one that says, you know, 6 out of 10 Americans are saying just slow down here, start from scratch, or others that say what you've got now isn't ideal. I think that one shows 7 out of 10. But they go full throttle. And I'm wondering, do they see something we don't? Do they appreciate something we can't? What?
I think they're just so determined from an ideological standpoint to do this that they're saying, damn the torpedoes, full speed ahead.
Yeah.
I will say this sounds an awful lot like that tax increase back in 1993 and 1994 that led to people like me being elected to Congress for the first time and forming the first Republican majority in 40 years. I think if the Democrats persist in this, we're going to see the Democratic majority be lost in both the House and Senate.
But you know what happened? You know what happened a couple of years after that? You got elected a couple of years after that. Bill Clinton got reelected because, you know, despite that tax increase, there was an economic boom. You could credit Wall Street. You could credit a lot of things. But it was a temporary setback.
Well, you know,
right?
Bill Clinton was reelected, and we'll take care of that issue back in over in 2012 with President Obama. The people will make that decision. But I'll tell you what we did in the meantime. We cut the budget, and we passed welfare reform, and that sort of moderated Bill Clinton in the views of the American people.
Well, we'll see if it happens with this.
You're right.
We'll see if it happens with this guy. Senator, always a great pleasure. Thank you very much.
Good to be with you.
It's basically a run-of-the-mill. It's one of, you know, hundreds of healthcare caucuses we've had, but it hasn't. It wasn't the big moment that I think when the